So now we're going to talk about the subarachnoid hemorrhage and its bleeding that is in the actual cerebral spinal fluid. It's caused by a rupture of a cerebral aneurysm, trauma, cocaine use, and your side says drug abuse, but a lot of times you see it with patients who use cocaine. There's no warning signs. This is the one that they will say, this is the worst headache of my life, and complain of a stiff neck. They may have signs and symptoms, but it's usually related to the location of the actual stroke, which is on page 1393, box 58-4. May have issues with motor, communication, aphasia, dysphagia, and remember we just talked about a dysphagia with a PH, and I should have told you that it's not the PH, it's the G. So you have dysphagia, and they're pronounced exactly the same except one is an S and one is a G. Emotion, memory, and judgment, and the left side of the brain is your memory judgment. The right side of your brain is more impulse and movement, like quick movements. You can also have something which I don't have enough room to write on my slides, so I'm going to stop right here and add a slide in. Okay, so let's go back to your dysphagia. Dysphagia with a G is difficulty swallowing. So I think GI. Swallowing goes with GI. And when I think about dysphagia with an S is speech. This is difficult with communication. So that's kind of how I memorize those two words, because they really, the only difference is one letter. So that's one way to remember those. The other thing is I had ran out of space to give you another term that you may see written. And I'm sorry, my handwriting on these looks horrible. And I promise it's usually neater than that. But the other term is spatial perceptual alterations. So what this means is the right side of the brain looks at the perception of yourself, judging distance, and something called agnosia. Agnosia is the inability to recognize an object that you should recognize. Remember we talked about in the neuroassessment chapter, there's a test you can do called graphesthesia or stereogenesis. Graphesthesia is where they close their eyes and in the palm of their hand you draw a number and they have to identify it. The stereogenesis is where you hand them a familiar object like a paper clip, and their eyes are closed, you put it in their hand and they have to identify it. Someone who has a stroke on the right side of their brain will probably not be able to identify that object. They may also have issues with elimination. I do like this little diagram from your textbook because I think sometimes it's confusing or you can almost get it backwards. But if you have damage to the right side of your brain, the effects are going to be on the left side of your body. So right stroke, signs and symptoms left. Left stroke, I'm going to have signs and symptoms on the right. So I do like this little box where it breaks down what you would expect to see or what signs and symptoms you would expect to see. So your diagnostic tests, we went through some of them when we talked about your neuroassessment chapter. You have more on page 1395. 58-5. One of the things that needs to be done is you need to confirm a stroke and another brain injury. You need to identify the cause of the stroke. These are important factors in treatment. CT and the MRI distinguish ischemic versus hemorrhagic. They're not going to take the time to do contrast, so it will be a non-contrast CT. You can have a CT angiograph where we're looking at the actual cerebral blood vessels themselves. You can have a cerebral angiograph where we are trying to detect the subarachnoid hemorrhage. Preventative issues we'll talk about in a minute. Surgical therapy could include a carotid endarterectomy, which is the picture that you are looking at right here. They are actually going in to the carotid artery and removing plaque, which you can see. They can also do something called a transluminal angioplasty while they're in there removing it, or they can do a repair. When they do the angioplasty, they're actually putting a balloon into the stenocarotid artery. They can actually do this or thread it through the femoral artery up into the carotid artery when they do the angioplasty. When they do the carotid endarterectomy, they actually remove the plaque directly from the neck. So they'll have not sutures, but most of the time it's staples in their neck. They can do stenting. They can put in filters that will remove any junk. They can do an extracranial to intracranial bypass. This is where they're actually anastomosing the branch of the extracranial artery to the intracranial artery beyond where the obstruction may be.